your experience there. What was it like?
Thank you, Mike, for having me on the show. Actually, the situation now in Shanghai is improving, as you stated earlier in the segment of the program. Life seems to be going back to relatively normal, and the traffic is getting up again, and things are calming down here, and the new cases of COVID-19 infections seem to be mostly, if not entirely, coming from international returnees, I guess mostly students or Chinese nationals. And
I was reading about Shanghai and how it mobilized once it heard about the cases in Wuhan. By early January, doctors in Shanghai were already training, already preparing, even before the first COVID-19 patient presented. Give me a sense of how that helps when you have an outbreak like this and the chance that you're going to be hit with a lot of patients.
Well, this is really, I mean, this is the first time I've never seen, probably mostly anybody has ever seen in a lifetime. Yes, when Wuhan epidemic broke out, Shanghai supported the Wuhan epidemic was, I don't know the exact number, but probably half of its medical staff with all the supplies, and it was a very significant dramatic, that's what I meant. And well, eventually, later on, the Shanghai also started showing these infected patients. And about 2 weeks ago, we did an interview and with a couple of other experts on the panel. And at that time, we had about 360 COVID-19 patients. And the numbers are relatively small. And Shanghai, the whole country was in a lockdown mode in Shanghai as well. People were staying home, and the streets were nearly empty. And all the shops are closed. And so the 60 patients, about 50 of them received high-dose vitamin C. And eventually the Shanghai expert panel and the Shanghai city government also adopted a high-dose vitamin C as part of the standard of care treatment for COVID-19 infection. And Shanghai seems to me is a lot more open-minded and more straightforward, looking at the real values of all treatment modalities. The truth is that we don't have too many active antiviral agents out there. We wish we had. We wish we had a vaccine. We don't. And vitamin C and the other nutrients are one of the few natural agents that have a very high safety profile, and they are also very actively antiviral and the support of the immune system. And in particular, vitamin C is a redox molecule, and one of its potent effects is the antioxidant capacity. And the leading mechanism, leading to the leading cause of COVID-19 is the pulmonary injury, the ARDS, acute respiratory syndrome, distress syndrome, and which is caused by the high levels of free radicals. And the antioxidant here plays a critical role in that. And not only this time, but lots of research in the literature showing the basic mechanisms and the clinical case reports and the studies.
Let me ask you one final question before we let you go. Talk to us about the differences you're seeing. You know, you're there in China, but you obviously are watching what's going on around the world. Hard-hit areas like Italy, Spain, now an onslaught of cases in the U.S., New York getting hit really hard. Any lessons learned and just differences in approaches that you've noticed?
Well, I think actually more or less I see a similar pattern, is that when it broke out here in Shanghai, early on it was a little bit chaotic and people didn't know how to expect. But pretty soon the governments at different levels were taking very tight policies. And as you see, in about 2 months-ish time, things begin to calm down. And early on I see the same reaction worldwide, including the United States, that we probably didn't take it as serious as we should. But right now I see the governments locking down schools and everything. And I have a feeling, I'm an optimistic person. I think probably within 2-3 months of time, this will peak and gradually will be over. And that's one thing. But one other thing I really I've been making a lot of public appeals, is that we need to pay attention to preventive measures. other than the wearing gloves and wearing masks and isolation and all these very excellent measures, do not forget that vitamin C has been proven in history. A lot of people don't know this. Vitamin C can prevent people from catching virus. Vitamin C can reduce and improve the symptoms of mild cases by mouse. And vitamin C at IV, which can reach much higher blood levels of vitamin C levels, can treat mild to severe cases of these. We don't have to wait passively for COVID-19 to get us. We can take active measures. And this, I hope, we can get the message out to a lot of people, particularly those high-risk groups like healthcare providers and senior citizens and probably immune-compromised people. Take high-dose vitamin C. It's very safe and it's very effective. And actually, I'll be talking on this at NIH.
All right.
I'm invited to give a